on the top of your shoulders called your head.
How do you palpate for that?
Big bone on shoulder.
And try to keep it simple. I believe in the KISS principle and keep it simple, stupid. All right. Go. Thank you. Thank you. Come to life. It's funny, like have you walk into class and you have the skull like fall from across the room.
That's creepy.
Excuse me, what was that? Sorry, go there. Excuse me. Who can I help? All right, so the skull. We've got lots going on up here. If we start up here, we've got 4 major bones that we're kind of concerning ourselves with. We have our frontal bone. Many of these you've seen, you've taken quizzes on. They should be well endowed into your brain. Parietal bone. Okay. Temporal bone. With your external auditory meatus, which kind of comes out of this little pokey hole right here. Poke some in the ear, you can jab it right through the temporal bone. And then we have back here, we have the occipital bone. Now, what's occipital bone? Why is that relevant to what we talked about last class? Attachment to lots of stuff, right? So, if we look at that, up here is pretty much where the traps come in, and you've got your splenius capitis here and here, right? Off to the lateral side just a little bit. And then if we go underneath, then we can find a whole bunch of other little suboccipitals, which are going to come up and through this bottom area outside here. So what's that big hole called that sits right in there?
Magnum.
Foramen magnum. So what comes out of that?
Jugular. Spine.
Your spine. Yeah, brainstem spine comes out of there. So bones of the face. Your cheekbones. Lovely combination. That one is the main one right there, your zygomatic bone. Then you have your maxilla. Now those two structures right there, even down in here, the nasal flares right there, these are cartilaginous bones. Usually, if we get into where we have somebody gets hit on the nose and they have a lot of swelling or a lot of tenderness right here on the bridge high up, that's actually the junction that you have. A little bit much. Okay, cool advisor. How exciting for me. All right, so that junction right in here, where that cartilage meets up with the bone, is a bit of a joint. And so you can actually damage to where you're stressing the cartilage connection to that bone. And that bone is your nasal bone on either side. So broken nose is typically where we're looking at this cartilage being shifted or separated from that space. So it's a cartilaginous damage, not so much a bony damage. I have seen some pretty impressive nasal problems before. I had a baseball player, I forget what base he was playing, but they were playing indoors because it was in Boston, and you can never go outside in baseball season in Boston. So he dove for a ball. The dude probably weighed about 250, and he was just very, very dedicated to catch this ball. And so he extended all the way out and decided to catch his body weight with his nose. So it crushed his nasal passage in here, and it didn't look too terribly bad, but it had damaged most of the passageway on the internally, so they actually had to go in and reconstruct most of his, yeah, it was pretty good. Those tend to bleed quite a bit, and it's terribly unfortunate and unhappy. And that's how the Egyptians get your brain out. They pull it right through those holes right there. Excellent. All right, so we'll zoom back out of there a little bit. All right, so mandible. Mandible gives you your ability to eat, chew, all that kind of happy stuff, so we can consume food. Like, I mean, what would McDonald's be without the mandible? So bony structures we're pretty good with. We can make that go away like just the muscles. The muscles make everything look a whole lot scarier. Except, I want to back step 1 second. So to simplify life in terms of what it looks like, again with all of these happy little bony archways and everything, there's an easy way to kind of go through an assessment process of the face. And so we'll deal with that here. Even though it could probably fit in ortho, we've got more time to do it here. So the idea is called something called Dolan's line. So we have three sets of passages that we can do palpations on. This will be on your oral final. So it's an assessment of the bony integrity of the facial structure. So line 1 is really this lower arc of the bottom part of the eye. So it begins at the zygomatic frontal suture, which is going to be this suture right up in here. And then you travel along the surface of the orbit through the zygoma, onto the surface of the maxilla, and up over onto the nasal bone. So, palpation there. You're starting up in here, anterior to the temple. That's where that the top zygomatical frontal suture is up in here. And you're going to follow along the orbit of the eye up onto the nasal bone. So palpating there for crepitus, for exceptional tenderness, for point tenderness. We're looking for signs of, or significant deficits, looking for signs of fracture. Line 2. So if you go back over to the zygomatic arch, and you find that zygomatical frontal, and you go posterior to it, so you go on the back side, and you're going to follow that down and go posterior on the zygomatic arch. You're feeling along here and going backwards. So that's mostly assessing the zygomatic bone.
Wait, can you re-explain that again?
Yep. Okay, so number 1. You're going zygomatic arch, onto the maxilla, through here, onto the nasal bone here. Come back up and around. Line 2, you're going zygomatic, backwards along the zygomatic arch.
Like you're going straight back to your
Pretty much straight backwards towards your tip at the top part of your ear. Because that zygomatic arch is right in here.
Is it the actual arch or is it the superior?
You're actually going on the top part of the arch is what you're
Top,
feeling.
okay.
Going backwards. And so that gets us to line 3. Line 3 is, so if you end here on line 2, you flip onto the inferior side of the arch, and you come forward on the arch, back onto the maxilla, and that gets you into the inferior margin of the zygomatic arch,
This is just,
along the lateral wall of the maxillary sinus.
this
So,
is line 2, I think.
so 1, you could probably start, if we could actually flip that backwards, start here at the eye, follow that eye orbit up and around to the zygomatic arch, flip over the zygomatic arch, you can follow the arch backwards towards the ear, flip down underneath, and then work your way forward. So it's pretty much tracing the lines of the primary facial structures of the primary bony structures of the face. So what would be good to know? What would be good is that you understand which bones you're covering. So nasal bone, maxilla, zygomatic onto the frontal, flip over and you've got frontal and zygomatic, and then flip down below the zygomatic arch and you've got zygomatic onto the maxilla. It also helps you learn where those bones are. Now there's a couple other fun happy bones. We can talk about the ethmoid, the sphenoid. If you've messed those up, they're in a hospital. So we'll just leave it at that. I mean, because we're getting into the internal facial structure, and there's a whole lot. You've touched those anatomy physiology. They aren't quite as functional in here. Head and I guess we'll do.
And that'll be on the final.
That'll be oral final, yeah.
That'll be it.